Welcome back to another episode of The Nudge. I am your host, Diego Carrete, and I've spent my life helping people live better. On the show, our guest stories will inspire you to move, eat, sleep, and think better, meeting you where you are in your wellness journey. Now, be sure to click that subscribe button so when a new episode goes live, you'll be the first one to know. Gerry, thank you for being here at The Nudge with me.
My pleasure, Diego. Thank you for having me.
I want to start by asking you, for those who haven't met you before, how would you define what you do and why do you believe that motion is life or is the essence of things?
Okay, well, to just give you a little background on me, I'm a chiropractic doctor. I trained in the United States. I practiced in the United States for 18 years. Taught in the United States and trained other chiropractors in California as an assistant professor. And then traveled to Dubai, was recruited here, and been here for about 17 years. And my whole philosophy and what interested me in what I do is getting people back to their functionality. Because when people lose their functionality, it directly impacts upon their quality of life. They can't do what they love to do. They can't do what they need to do. Work harder, play harder, can't interact with their kids, can't participate in the hobbies that they love. And the greatest kind of attribute that I've been able to do in my 35 years is be able to return my patients to what they do using the skills in my hands and the knowledge in my brain.
And what was that first ignition, or what drove you to pursue your career in the first place?
Great question. So one of the memories that I had and why I chose to be a chiropractor is when I was a young boy, my mom was getting ready to go to a wedding, to my aunt's wedding, and she woke up with a horrible stiff neck. And she could barely lift her head off of her shoulder. And she was so upset. She was, her baby sister was getting married, and she was distraught. She wasn't going to be able to participate in the wedding. And lo and behold, in our hometown in the U.S., she went to see a chiropractor, and boom, in one visit, she was able to go to that wedding, have a great time, use her neck, and enjoy her life. And that impressed upon me at such an early age is, wow, if I can do something like that to somebody, wouldn't that be great? And
And since then, it's been 35 years.
35 years later, I'm still doing what I love to do and treating patients and getting sick people well.
Still pop up in the clinic and staying out of trouble? That's what you always tell me and everyone, right?
Typical American phrase from where I'm from. I'm from the East Coast in Boston, and that's what we say, yeah.
No, one of the things and that to me is really, I don't know, it just makes me happy, is that your energy has been consistent throughout the last 10 years. Mm-hmm. I don't know how you do it because life has its episodes, and I will ask you about the episode that you've been through in 2020. Mm-hmm. But you've always kept this energy and this, I guess, is passion.
Yeah, passion and the responsibility, as a healthcare provider or a clinician, you're responsible for your patients, or you should be responsible for your patients. And getting a person to follow your advice and listen to your advice as far as health, you want to display a positive attitude for yourself and for them. And people don't want to hear or see doctors who have problems. They're there for themselves, and you're there to assist them. So one of the things when I was training my doctors and my interns is when you enter that room with a patient, your focus and your priority is that patient. You have to put them first And for that 10, 15, 20 minutes that you're interacting with that patient, your attention is on them and focusing on them. That's your job and responsibility as their health provider.
And how do you manage that? I'll tell you why I ask you. At work, myself, kids, life, parents, you name it. Like, how can you compartmentalize like that? Do you have any rituals that, okay, now that I enter the clinic, I'm this, invincible, like focused person? How do you do that?
It's a skill set. It's a learned behavior, like any other learned behavior. Does it start off like that? No. But with practice and communication skills and empathy and kindness, it develops into that. And, one of the things that I joke with other doctors and students and clinicians that I train is, that's why they call it practice, right? It doesn't come out like that at first. It takes skill, it takes time, and it's a learned behavior.
I cannot agree more, actually. I keep practicing so I can become better.
Yeah, keep up with it, right? Yeah.
Now I'll ask you about 2020 and how that episode, those times, made you change your perspective on health or re-emphasize certain things. Walk me through the before and after.
Yeah, so as you know, 2020 pandemic, COVID, everything was closed down, and then we started to open up, start seeing patients again on an urgent basis, patients that needed care. And during 2020, I was lucky for most of it to be healthy and careful, and then I got struck with COVID. And went down with COVID, and everything was great. And I was out my couple of weeks, going to go back to work. And the night before I was going back to the clinic, lo and behold, I woke up and I had numbness on the right side of my face. And I said to myself, this doesn't seem to be good. I said, something's going on here. And immediately I recognized that this was a stroke in evolution. Okay, we're going to have an issue here. And I was able to wake up my wife. I said, "Hun, Habibti, wake up. I need you to call 999 because I'm having a stroke." And she did, and lucky she did. And at that point, I started to lose my voice. And long story short, I was fortunate. I survived that. Took me about 3 or 4 months to regain my functionality, and it was hard work. And that's why I practice what I preach, okay? Every day I was out walking. I had to walk with a walking stick, with a cane. I was dizzy, but I didn't let that stop me. I pushed through it to get back most of what I had lost. And alhamdulillah, thank God, I was able to return to do what I love to do, see patients, part-time first. Still don't have the energy and stamina that I used to have, but back at it, doing what I love to do. And that taught me a lesson as to what to prioritize in life. Yeah, health first, and the people around you, loved ones.
And rest second. See, yesterday I was reflecting. I think I even posted on LinkedIn a video because I was stuck in traffic, and I was thinking at the same time how we have become so, even myself, everyone, stuck in this constant pursuit of more, of not enough, of lack of contentment, and it's never going to be enough. As someone who is going through chronic anxiety since many years, and mental health runs in pretty much everyone in my family, then I was telling my dad today, who had a surgery this morning, I was quite, trying to keep myself distracted. I tell him that if you're not happy now, there is no amount of money that will take you out of that rut. Because I think money can make you a little bit better, but when you are like down or like it's not going to drastically change the picture. And that's what I'm trying to instill in him and even in myself when I get so focused on maybe numbers or growth or this property here or my career. I need to be, I don't know why we are in this situation. Do you have any clue?
Well, I think it's our society and lifestyle, and especially, here in Dubai, glitz and glamour. We look at the lifestyle, and I ran into this when I had my kids here. You grow up children here, and it's very important to keep them grounded because, fortunately, we have an insulated bubble here. It's not like the rest of the world. It's very, very different. Alhamdulillah, we're very lucky and fortunate. But by the same token, we have to be careful that we don't get carried away and impress upon our children that this is necessarily the lifestyle that is part of the rest of the world.
How did you manage that?
Well, what I did when they got to a certain age, I told them it was time to go back and get a job and see what the real world was like. And then they could make a decision on their own. So my two sons, as they entered their last years of high school, they went back to the U.S. and finished up high school in the U.S., one went into university in the U.S., one went into the workforce. And they're both phenomenal kids and well-grounded.
That's the most important.
Exactly.
Any of them chiropractors, future chiropractors?
No, they aren't. And I never impressed upon them what they should do. I always left it up to themselves to make that choice.
Fair enough. Also, my whole family are doctors. And I wanted to become a personal trainer. You see, I finished uni. Business, good, grades. And I said, no, I want to dedicate myself to fitness.
Health, yeah, right?
I guess my dad was, are you going to become a personal trainer after 7 years in university? You have an honors degree, blah, blah. I said, I didn't say personal trainer. And if I want to, it's fine. I will do something, but at least I'm going to focus on something that will keep me alive for as many years as possible,
and
right?
Happy. Yeah. Because, it's very difficult to keep going to work if you're miserable. And people do it every day. As I shared with you before, and I had a patient say to me, Doc, how long have you been in practice? I said, 35 years. And he said to me, do you still love what you do? And I said, yeah, every day. I love what I do. How could you do something? I couldn't personally do something that I didn't love for as long as I have, because that's going to reflect upon people.
Yeah, you're going to have a massive churn on patients.
Exactly.
But I was there this morning and I was blown away once again. Just a little manipulation and the impact in the range of motion was, very crazy and still surprises me to this date. And we discussed something that I want to bring up in this podcast as well, which is you have neck pain, you have back pain, yet the source can be elsewhere. So talk us through that again.
Yeah. So again, part of an evaluation of a patient is to identify what the etiology or the source of the pain is. For example, a patient with back pain, is it mechanical or is it non-mechanical? Is it coming from the bones, muscles, and joints? Or is it potentially coming from the visceral organs, which needs to be evaluated, okay? Is the pain that they're getting in their leg, is it actually a pain in their leg? Or is it a pain from a disc that's been herniated that's pinching upon a nerve, sending pain into the leg? Or some of the facet joints, which is referring pain into the leg. So the whole premise of referred pain in regards to origin and etiology is very, very important to identify. For example, in a cardiac patient, if a cardiac patient is having left arm pain or jaw pain, then the problem was with their heart. If you treat their left arm pain or their jaw pain and ignore their heart, that patient's not going to make it, right?
That's probably the best example, right, for people to understand.
Exactly.
And when it comes to muscles or joints, or what is something that can be typical where the person says, "Oh, my neck hurts," and you're like, "It's your pinky." Like,
No, I'll give you a good example. So let's, for example, say patient has a headache, okay, posterior headache or temporal headache, and you examine them, and it's not a migraine or it's not a cluster headache or anything, but it's coming from their neck, okay, and they have a condition that's called cervical spondylosis, which is a wear and tear condition that affects the joints of their neck, and it makes their neck overwork. It increases the tension on the muscles and the supporting structures, and they wake up every morning with this headache in the back of their head, right? And that is coming from their neck, okay? It's not a problem with their head or anything in their head, but it's a problem with
maybe
the joints
also
of their neck. Yeah.
Maybe.
Yeah.
You never know. No, but I get it. I want to share something with you. I went the other day to see my friends from Dr. Stretch. It's assisted stretching. And I went there to see them. I ended up doing a session. Okay, there was this exercise. So tilted my neck to the left, 45 degrees down. And then as they extended or kept my neck isolated, pulled my head down, I felt like, and it's the second time that happens, like really, like a electrical shock all the way up to my brain.
Yeah.
It was unbearable. I have a great degree of pain tolerance. I got 4 hernias operated at the same time. Like I can tolerate pain. This was something like an electric shock.
Yeah, so whenever you have a patient who's complaining of electrical type of pain or burning or numbness or tingling, that's a general indication that the nerves are being involved. And from what you're telling me, it sounds like stretch was put on those nerves, that nervous structure. They got a bit irritated, and then they responded accordingly. So nerves, which send signals of communication, they don't like a couple of different things, actually 3 different things. They don't like compression, they don't like stretch, and they don't like to be pulled on, okay? So if the nerve is particularly angry or irritated and you do that, you could get that electrical type of sensation or burning sensation or numbness or tingling.
I was a bit scared. I was like, what is he going to say? But I was doing the active stretching. And now this links to my next question, because a lot of people, including myself in the past, are confused, or they don't know the clear difference between I have done a deep tissue massage and why should I go to the chiropractor, or now I have to, do active stretching or stretching. What is the difference between those 3? How do they complement each other?
Awesome question. So let's kind of generalize this. So picture this. The body is a machine, like a car, okay? And picture the car isn't running right. And you take it to the mechanic and you say, you know what, I think there's a problem with the tires and you should change the tires. And the mechanic says, all right, I'll change the tires. So the mechanic changes the tires and you take the car out for a ride, and guess what? Still not running right. So now you have a car that's running with 4 brand new tires, still not running right. So you bring it back to the mechanic and you say, hey, you know what, the car is still not running right. Why is that? The mechanic says, hey, listen, you told me just to change the tires, but you didn't tell me to line up the front end, to balance out the tires, to rotate them. There's a lot of stuff that's going on. So the point is this, to your question now, is the musculoskeletal system is a complex thing, but it's not just muscle, okay? So if you only address muscles, and what's the function of a muscle? A muscle moves a bone, right? But if the joint isn't properly balanced, if it's not moving properly within its range of motion, well, if you strengthen it or you stretch it, okay, that may not address and probably not address the joint mechanics because you've only addressed the muscle. What's cool about chiropractic, or what I do, is that manipulation or that adjustment. What does that do? Well, that mechanically resets that joint by affecting what's called proprioception. That's the sensation within the joint, so the joint can return to normal motion, and then your stretching or your rehabilitative exercise is much more effective. A lot of times when patients come to me and they've had, I've gone for a massage every week for 4 weeks and my pain's still not going away. Guess what? That's because the pain isn't just muscle. There's something else going on. We need to evaluate what that is, and usually it has to do with underlying joint dysfunction that hasn't been addressed. The same thing when patients go to physical therapy. I went to the physical therapist and they gave me exercises and I felt okay. I stopped going and it came back. What's going on? Again, what we've done is we've strengthened up a relationship that wasn't optimal, and that's why just working on one particular area didn't work. When you're looking at the musculoskeletal system, you have to remember there's a lot of hardware in there. There's bone, joint, ligament, muscle, right?
Indeed. Example this morning when I got there was one leg was significantly...
Yeah. So we looked at your pelvis.
Yeah.
And what we saw when you lay down, face down prone, is you had a significant leg length, what we call as a functional leg length discrepancy on the right side. And, it's like, oh, is my leg really short? Well, no. I mean, there's two differences between short legs. There's anatomical, which is, let's say you've had a piece of bone removed or a broken bone and the bones are actually short, or there's functional, which you have. It's mechanical. It means your pelvis was rotated and one leg was functionally short. So what we did, we evaluated you, we adjusted you, and boom, lo and behold, it lengthened up. And we said, whoa, wow, what's going on here? And it's not magic, it's just mechanics. We've adjusted the mechanics, reset the proprioception so the leg has lengthened, and then now what we need to do is work on strengthening and stability so that relationship holds longer. And again, I'll go back to that car analogy, right? So you take the car to the mechanic and he lines up the tires or she lines up the tires and it runs right. Well, does it run like that forever and ever? No, of course. So, in 20, 30,000 kilometers, you got to bring it back in, right? Because wear and tear and you hit bumps, and that's called life.
That's indeed.
Yeah.
Well, imagine I instead of coming to see you, I would have gone to release therapy or deep tissue. How would that have solved the issue? Not at all, right?
Yeah, well, so what it would have likely done is address the tight muscles in the gluteal region, in the piriformis region, in the IT band, worked on all of that, but it would not have solved the joint issue, which was the fixation of the pelvis and the sacroiliac joint, okay? So to answer your question in short, you probably would have felt better, but then in a day or two, back to where it was. Yeah.
And what's the frequency? Before we go into the next, I want to talk about energy. Yep. I want to talk about, things that I believe in that more and more people are trusting and believing in as well. What is the right frequency before we get into that on visits? Is it independent? Is it 2, 3 weeks, 4 weeks?
Yeah, so in general terms, it depends on several factors. It depends on what the problem is, how long it's been going on for. Is it acute? Is it chronic? The extent of it, how severe it is. And it depends on the individual patient, their age, their health, and other factors.
History, sport history, medical history.
Yeah, so everything. But in a general sense of this, I see patients in an acute setting. We reevaluate the patient every 2 to 3 weeks, and what we look is for successive progress to make sure they're on track. Your average recovery rate is anywhere from 6 to 10 visits. For chronic conditions, it can be longer. For acute conditions, it can be shorter. But usually between 6 to 10 or 12 visits handles a great majority of patients' complaints.
And throughout that time, something that is key to recovery, and I genuinely believe in that, is the mental side of things and the energy. Walk us through how that plays a role in the healing of your patients.
Yeah, so the mind-body connection, we have not understood the full aspect of that mind-body connection until very recently. The biopsychosocial aspects of health are extremely important. What motivates a patient to getting well, their psyche, their ability to comply to instructions, their enthusiasm in participating in their care, all of those are extremely important factors for recovery. If their ability to heal themselves, that comes from within. And if that is impeded, their expectations and their outcomes may not be where they want them to be. Yeah.
What was that test that you did this time that I came around the other day after a while, after many years, and we saw each other for the first time? You did an adjustment. I was a mess, I have to admit. Thank you for that. But I remember you did a test or something. When I brought up kinesiology. What is that you did?
Yeah, part of the cervical examination that we were doing is we're just doing a neurological upper body screen. Need to make sure that all of the neurologically everything was working. We put you through a series of tests just to ensure that everything neurologically is functioning well. Any proper evaluation of the musculoskeletal system should include a neural evaluation.
And that's something that only in the recent years has become more and more prominent, perhaps, or more.
Yeah, it depends from doctor to doctor, but as it's part of my training and part of what I do routinely with patients.
Fair enough. What I've seen, though, in the recent years is the shift from what Peter Attia calls medicine 3.0, which is the jump into more of the patient going into the driver's seat as opposed to staying in the passenger seat.
Yeah, so you're talking about what's called patient-centered care. And yes, medicine and healthcare as a whole has now shifted into promoting the active role of the patient. Because, again, what we've talked about just a few minutes ago, the patient should be in the driver's seat. And one of the things that I impress upon my patients is that we're a team. You cannot rely on a healthcare provider, doctor, therapist, whatever, to get you well. They serve as the guide to getting you well, but it's an active process that is at least 50%, okay? We point you like your model for your company, the nudge. We point you in the right direction, okay? But you have to take that initiative, right? I can show you how to do the exercises that you need to do, but I can't do them for you, okay?
Well, being in the coaching and mentorship space for many years as well myself, I always tell my students, I care for you, but I cannot care for you more than you care for you. That doesn't work.
Right. That's why we were talking to some of the employees at FAB, and we got a question this morning about I don't have time to do it. So we turned it around and said, well, if you don't have time to do it, who will? And I treat a lot of families. I treat husbands, and they refer their wives in, the wives who are better referring their husbands in. And I say to them, listen, especially with a mom or a wife, it's like, if you're not going to do it and you're not feeling well, you're the backbone of the family, right? Without you, everything falls apart. Right?
Exactly. Yeah. And I think it's about integrating this. I'll give you an example. These tables are not I wouldn't blame the tables. I blame my height. I'm too tall. Yes. All right. So I have adjusted my posture probably like 3 times already. So I'm centered. I'm sitting towards the back of my chair. I'm engaging my core purposely, even though the mic is too low. So I'm trying to do this balanced act here. So it's not always an effort, or you don't have to get out of your way to take care of yourselves. It's about these micro adjustments and these things that you do almost subconsciously that help you get better, right? Because if I would have let myself go for the whole session, I would have ended up, before I came to see you. And, I'm adjusting. So it's about raising that awareness and those habits that you can incorporate on a daily basis, which I'm going to ask you about. What are those that you recommend that all of us can do?
Be active. Too much as a society, we sit and we've lost our mobility. Now, more than ever, we've become a media-dependent society. Social media, Instagram, Facebook, spending too much time on our phones. We've lost the initiative to get out there, especially which makes me sad with the younger generation. When I was a child, kids were out all the time, from sun up to sundown. Now the kids are in the house, being less active on gaming consoles, on computers, on their phones. We've lost the initiative to motion, and that's probably the number one thing that we need to focus on is getting moving, because not only is movement life, motion is medicine, right?
I would say that the kids learn to scroll before they learn to crawl. I just realized, like, wow, my son is already going up and down with the YouTube. I mean, we put some, I'm a good dad, I promise. But yeah, it's kind of puts things into perspective.
It does.
I have some stats to read for you. I've researched them after our meeting this morning. I like to bring this. So, which one is the one that surprises you the most? Okay. So, our ancestors walked 16 to 17,000 steps a day. We average about 5,000. That's number one. This one is the one that prehistoric women had 11 to 16% stronger arms than today's Olympic rowers. It's kind of insane. And then, this is the third one. We process more information in a day than most humans did in a lifetime. Which one is the one that...
Well, the second one surprises me the most.
Yeah.
That third one, again, with the bombardment of social media, I can just imagine. I mean, that doesn't surprise me at all. But that second one, imagine that, right?
We are talking about, prehistoric times. So, again, I don't know how, I fact-checked this twice. It might be a little bit inaccurate, 1%, 2%, but the facts are there. But the fact that our ancestors were so much stronger. But look at the grip strength, how it much has decreased. It's a marker for longevity. Most people cannot hang for, 30 seconds nowadays in their 40s. Grip strength has decreased massively because we barely use before it was all the time. But the grip strength of a woman, or the strength, more than an Olympic rower nowadays, it's
crazy, right? Absolutely crazy.
Props to them, right? Okay, let's resume with discipline, because after there's a little nudge, then you must carry on by yourself. After you instruct a patient, after you coach a patient, they must instill some discipline to carry on by themselves until the next visit. So, from your experience, or in those times where you had to, be disciplined and really show up after the episode that you shared with us, what has that taught you, or what would you recommend to someone who needs to carry on with that?
Yeah, I mean, I think in life, one of the life lessons that I've learned and tried to impress upon is that motivation is fine and good, okay? You can be motivated to do something, all right? But it's not enough. It's not enough in business. It's not enough in life to be motivated. You need to have that discipline and that consistency to show up. Because you could be the most motivated person in the world, and if you don't have that execution by that discipline to show up and put the work in, then that motivation is wasted. And that, I think, is the key for me, anyway, with any sort of success. And I think as a good rule of thumb, for example, when I have a patient who has a postural issue, I try to be upfront and honest with my patients all of the time. Patients come in and say, you know what, I'm not happy with my posture. I want to change it. I said, okay.
Does that happen a lot?
All the time.
Like, because
all the time, yeah. Yeah, especially here, because people are on the computers all day long.
I want to show you something so you continue. I took this for you yesterday. This is what I witnessed in the office.
So we see that at the desk, eating lunch, on the computer, forward head posture.
Kyphosis, and then there's
rounded.
and then the neck on the other direction.
Yeah, we see that all the time.
It's crazy.
Yeah, that's our life now, right? And they say, I want to change my posture. Okay, you understand that to change your posture, it's going to take not only the motivation to change your posture, but it's going to take your discipline to do the exercises and your consistency to do the exercises on a regular basis, because it's a habit like any other habit. Lose weight, stop smoking, going to the gym. You go to the gym. Okay, I'm motivated to go to the gym. But if you don't show up at the gym, doesn't mean anything, okay? And if you aren't consistent at the gym, you don't see the results. The same thing with posture and life, right?
I think unlocking the real reason. I think when you ask somebody, why do you want to lose weight? Why do you want to improve your posture? I said, because I don't like it. At the end of the day, self-esteem, pain, perception from others, lack of ability to show up as their true selves. I think there is a bit of work always to be done on the real underlying why, because it's going to become boring. When you do something for so long, there's days that you just don't feel like it. I think you have to be a magician to make it excitingly boring.
Yeah,
and
you hit the nail on the head there, right? So in what I do, I have one of the greatest motivating tools of all time, a patient in pain. A patient in pain, when they're in pain, is pretty much motivated to do anything to get out of that pain. The problem happens when they start to feel better. That pain becomes an afterthought, and then they go back to the things that contributed to them having that pain. And then they have to be educated as to why they can't resume that type of lifestyle, and it's more difficult, and it's a challenge, and it does present some challenges. Like you said, if that patient doesn't have that underlying desire or motivation to make a change, then they don't.
And I think sometimes it's also awareness of the hard facts, uncomfortable truths that sometimes are communicated through uncomfortable conversations. Mm-hmm. I'll give you an example. You know, and this is a personal matter to you because of your story, I don't want to mess up the percentage, but I think 40% of the heart attacks, you know what the first sign is?
No, go ahead and tell me.
Death. Because there is such a big percentage of heart attacks that they become fatal on the first time, right? Now, how do you prepare for that? There is that preventative care, but if you are aware that, you know, this is what might happen, you will start taking action. When we discuss the hip fracture, that in 3-4 years, X amount of hip fractures, people die because of inactivity, inflammation, right? If they would be aware of, I must work on my mobility, because if I fall down the stairs and I break my hip, X amount of people out of Y amount of people die. Wow, that stat is scary. Then you work because you run away from pain faster than you run towards pleasure. Mm-hmm. So I think sometimes bringing the reality, you know, there is a guy, a good friend of mine, Arjun, he tells me, Diego, every time I read your LinkedIn posts, they feel like a kick below the belt. And I'm like, are you changing your behavior because of that? I'm just, you know, breaking down your scroll patterns with some truths that maybe change your behavior. So sometimes we need to be.
Yeah, I mean, patients in pain. One of the hardest conversations you have to have them is a patient with back pain. They don't want to move. They want to stay still, and they have to work through that. Yeah,
that's what did you say this morning? Tolerable.
Yeah, so what we tell patients is they have to walk or move to tolerance, okay? Because that walking isn't going to hurt them. The body was meant to move. It was meant to be in motion. And when you stop moving, that's when bad things happen. But they have to take a leap of faith. They have to believe in the doctor, to trust the doctor that the advice that the doctor is giving them is actually going to be beneficial to them. And once they've done that, and they start moving, they understand that, yeah, you know what? It hurts a little bit, but it hurts a little bit less today. I was moving a little bit more today, and that's a good thing.
Random question, I just thought about it because I was thinking my ADHD kicked in. I was like, 17 years, Dr. Gerry has been here. Wow, Dubai has changed a lot. That was happening in my mind now. Now, in these 17 years, you have had a flow of patients almost on a daily basis, right? Throughout 17 years. Did anything has changed, evolved? Are the trends the same? What has accelerated? What has changed?
What has changed? Well, when I first came here from the U.S., chiropractic wasn't as popular as it was, or it is now. Now, everybody wants to come. Okay, everybody wants to go to a chiropractor. Everybody's seen YouTube. Everybody's seen Instagram, and it sometimes gets to the point where I treat a patient. And they say, well, what about this? I saw this on Instagram.
When they hung
can't I have this? And I have to explain to them that, what you see on social media isn't necessarily what you need, okay? And, what we're doing here is a medical procedure like any other medical procedure, and it's individualized. So, stop watching YouTube and Instagram and let me treat you.
I think you must have a laugh or two when you go into YouTube and you see these young chiropractors sometimes. I don't mean young, but maybe they are in their 30s. Mm-hmm. Like, you've been doing this for longer than they've been alive. Mm. And you see, because it's very viral, crack, crack, crack. And then I saw some videos where they hang something on the neck and they pull back.
Decompression, the Y straps and all of that, yeah.
That looks very scary, like all the way back. Is that something that...
there are different tools in the toolbox, and certain procedures that you see on YouTube and Instagram aren't for all patients. And, I had a patient send me a message, I want to come in just for fun. I don't think in 35 years, I don't think that and I have a lot of colleagues who are doctor friends and dentists and things like that. I don't think I've ever had a patient say, I want to try this just for fun.
My dad is a dentist. Yeah? No one ever visited him for fun.
For fun. Huh?
Did you see an increase because musculoskeletal disorders nowadays, 40% of absenteeism due to low back pain, right? Or actually like any type of back pain,
Yeah, well, yeah. Actually, in the U.S., low back pain is the second leading cause of missed days from work. Mm-hmm. The first is a cold, okay, and the second is low back pain. So,
has that increased throughout the years here?
It is a huge problem for the healthcare system. About $800 billion a year is spent on lower back pain.
And how about neck pain? How's that?
This is kind of lumped in, extrapolated. It's in the top 10, but lower back pain is number 2.
I'll tell you something I'm very proud of. Okay. In 3 years, so actually almost 4 years, low back pain, it was ranked number 1 in terms of absenteeism or claim numbers at work, at FAB, and nowadays, number 3. So we have decreased.
So that's good. You're making progress.
Wow, that was such a relief. When Cristiano scores a goal, for me that was like, wow, bringing some actual data. And then, of course, you see the impact on people. And of course, it's not only because of me. There's 15,000 people are not, but it's a teamwork. You mentioned the word team. It was a team effort across the whole organization that we managed to get everyone more active through all the interventions. So that was a highlight, and I wanted to share it with you.
And one of the things I heard today when we were talking to the FAB people is they can get an ergonomic an analysis of their workstations, which is, I think, awesome.
We have posture ambassadors. So basically, our friend Olivier, a good friend of mine, ergonomist from Geneva, we flew him here, and then he equipped different ambassadors to be able to adjust workstations. There is no physical manipulation. It's basically the application of certain principles in terms of positioning of elements around the workspace, right? And whenever someone has certain, discomfort, or the first thing that we do is obviously advise to see a professional, like we did today live, because we have a very good insurance, and they can see chiropractors, physios. But when it comes to the workspace, we have these ambassadors. They will check on the website, they will see the name or the location, and we'll see who's closest to them, and they can contact them directly. They will CC me and my team, and we will make sure that that person gets looked after, and we see the before and after transformation of the workspaces. Some of us have a little elevation on the laptop, but still the downward angle is like, it needs to be slightly 10 degrees below the line of sight, right? Some of us have put a little bit of a surface to elevate it, still massively, like you cannot not get neck strain when you are pretty much like, even chairs, or it's not, you don't need a standing desk necessarily. If you cannot get it, you still can make improvements. But working from a laptop, from an work office environment for 8 hours without any type of adjustments, neck pain is inevitable.
Yeah, we talked about that again this morning, is the whole concept of repetitive overuse or repetitive strain injury. So what you're doing at that workstation isn't necessarily akin to manual labor, but it's the same thing day in and day out, month after month, year after year, and you have that cumulative trauma and insult to the soft tissue structures that reaches a tipping point, and then the last thing to come are the symptoms. But as you said, when you address it ergonomically, you're addressing it at the source, and you're trying to prevent that from occurring.
Well, that's what we have going on internally. We are looking forward to developing, and it's a very dynamic workplace and environment nowadays, so we're always looking to get better. I'm looking into some final words from you and word of advice for anyone at FAB watching us, for anyone in the UAE watching us, that, think that maybe it's too late to get better, to remove the pain, to lose the weight. What is your words from 17 years in the UAE and 35 years in the sector to anyone watching that wants to get better?
Yeah, so I think what you have to understand, or what you have to try to become, is a more educated self-treater. So one of the things that I try to impress upon the patients that I treat is this, is I'm here to help you, but moreover, I'm here, the function of a doctor is to teach you how to take care of yourself. So you can become a better educated, more informed self-treater. The first line of defense in any health issue is you, okay? And if you don't have the necessary tools or education or skill set to take care of you, then that's a problem. So one of the things that I always try to do with my patients is to give them what they need in order so they can identify the issue and better self-treat them. And then I'm here, or the clinician's there, for them when that doesn't work. So for example, in back pain, we were talking about this this morning. So most back pain, about 80% of back pain, goes away after the first 2 weeks. Now, who's treating you in those first 2 weeks? You, okay? And then about 90% goes away in the next 2 weeks. So in 1 month's time, about 90% of back pain is gone. And that principal treater, again, is you. And then we're here, I'm here, for when that doesn't work.
Thank you, Gerry.
Pleasure.
I look forward to seeing you soon. If that's not is a good sign or not, we can go for a coffee. I look forward to seeing you soon.
Look forward to it, Diego. Thank
you
you so much.